So today is February 3rd, 2022, and I'm here with Charlene Whitfill. And Charlene, I might just pass it over to you if you could kind of introduce yourself and tell us a little bit about who you are and what your background is.
Okay, so I'm Charlene Whitfill. I live in Arizona, and I'm a radiologist by as for my profession, which is the type of physician that does imaging. So totally not in the infectious disease world at all. I went to school, medical school at the University of Pennsylvania. So I was in Philadelphia for a very long time with my training, and then ended up in Arizona after I was done. And then my husband is also a physician, and he's a physician executive at one of the health systems in town where we're at. So he's an internist by training, and basically was helping run the hospital during this period.
Now, kind of looking back to December of 2019, how have you kind of been involved in any different pandemic response efforts, kind of looking at yourself living in Arizona, and what maybe also sparked your kind of initial interest in this area? We get for you to kind of touch upon that.
Okay, so December 2019, so at that point I had just decided that I was, I had just previously retired from working, because I was like, well, I wanted to spend more time with my kids. And so, I felt like I had was ready to try something else, or at least take some time off. So I just done that. And then we knew that, 2019, and then my husband was a executive at one of the hospital health systems in town. And so we were just kind of, we were puttering along. I don't think we had heard much about anything just yet. I mean, I remember thinking that it was December that I started hearing a little bit about something happening in China. But then when I read historically, most people say it wasn't really till January. So I'm definitely remembering it wrong, which is that's something that's stuck in my mind, how that's not quite right. So that's kind of where we were at.
Yeah, wonderful. And then kind of looking forward, how were you kind of involved in any pandemic response efforts?
Since I wasn't working, I was hearing mostly about the pandemic through what the hospital's preparations were, because they knew something was happening. They were aware that things were going on in China that did not look good. And, we're trying to figure out, what does this mean for us? And we had already Arizona had a couple of early cases of COVID appear that didn't go anywhere. That there was a group that had come back associated with the university on a trip to Wuhan, and a couple of people had COVID there, and they immediately, quarantined those people, and didn't go anywhere from there that we were aware of. So that's kind of what we knew from there. And but there were definitely preparations happening because I have a school-age child. We were preparing to go for spring break, and the hospital was deep into preparing, going, something's coming. We were starting to hear about what was happening in New York already. It was looking kind of scary. And then spring break was happening, and my husband was like, okay, this is going to be really bad. We're waiting because all the science was saying it was going to be really kind of crazy, but you don't know if it's really going to happen or not. And so that's kind of what was happening. And then, of course, my son's school closed and went online, and that was like a whole disaster. And then New York was happening, and that was really scary. And we learned a lot. The hospitals, Arizona was way later. So they learned a lot about what went wrong in New York and how not to replicate that. And it was simple things like, because there were just so many sick people in New York. There was, normally in an ICU, you would have one ICU nurse taking care of one patient. And in New York, it was so crazy. They had one ICU nurse taking care of 10 people. And that's just an impossible task, that you just can't do it. And so those were the little things that they were learning, that we can't do that. We have to figure out a way not to do that. And so, so that's what I was aware of, what was happening in the hospitals. They shut down all elective procedures. They kept the hospitals basically open, waiting for it to come. But things happened much later in Arizona than in New York. So New York had already been terrible, was starting to get better, when Arizona was starting to build up at that point. And then that's when I started getting involved. The school asked me to see if, there was any way we could open the school over the summer to figure out, could we do school in person, because they had realized pretty quickly after 2 months of online learning that it was kind of a disaster. It just wasn't going to work very well. And that's one of the, maybe the strange advantages. Like there, you could see a little bit of some political leanings, but not quite really there. But because we were in a place where we were like, where things were, it's much more libertarian here, that they were much more willing to try having school open than other places where the might have been much less libertarian in that view. And so because I'd seen what had happened in the hospitals, I was like, I'm pretty sure we can do school safely. All you have to do is, this is what we do in the hospitals, the PPE, these are the things that we can do. If we do all that stuff, we should be able to keep everybody healthy. And it was hard. I mean, the teachers all over the country felt the same way. And certainly the teachers at the school I was helping was kind of the same way. And I had time since I wasn't working. So I was like, well, this is not rocket science. I mean, a lot of it's rocket science, but to implement it, any doctor could have done it. I mean, you didn't have to be a specialist in internal medicine or infectious disease. And so I basically said, if we dress you up like we're in the operating room, then you should be fine. And I had to talk to all the teachers one-on-one, because they basically felt like we were putting them on the front lines to die. And that's not what they had signed up for. That wasn't what they were interested in. And they were not happy about it. And they couldn't be consoled. And so, I had to walk them, every single one, walk them through each one and walk them through their fears. And then we had to walk the families through, and then we started school. And luckily we started school when we were at a valley of cases. So we had gone through the summer where it was like crazy, lots of cases, and then it started to fall. And so we started school when there was not a lot of cases. And that worked to our advantage because it built a lot of confidence. Like there's just the probabilities of having a case on campus were really small. And so we managed to have school and have everybody practice doing PPE. And, we did all this stuff, but we had school every day, and we had classes every day, and we had the teachers doing the same size classes. So we didn't do any of the other things because they just didn't have enough staff to do that. And, we didn't have our first case until maybe November. So people were feeling pretty confident that we could pull it off because we happened to be in a place, we happened to start in a time where there wasn't a lot of cases. So that's kind of how we did it. And the whole year was kind of similar. We had our first case, we all freaked out, and then we figured out it's working and it's going to be okay. And that first year was really like, we felt like we had done something unique because so many schools have been closed. A lot of kids, you heard about all the stories about kids being online, and we hadn't had that. And we had kids in person. We had some, we ended up having about 90% of our families come back on campus, and then 10% of the kids were online. So basically we had virtually everybody on campus. We have about there's about 900 people in total. So 700 plus students, plus faculty and staff. And maybe over the course of the year, we had a total of maybe 30 to 40 total cases at all. And and so it was really up and down. Like we just kept getting from one goalpost to another. And then luckily also, it was really tense around the time when vaccines came out. Lots of people were really excited. And then we happened to also be in a state where they were like, it's going to be healthcare workers and teachers. Because the governor was tired of schools being closed. He's like, if this is what's going to get them open, we want to. So, because I had a little bit of an inside relationship with the hospital, I kind of knew what to expect or when to get in. And so we could get our teachers vaccinated really early with all the other teachers. And that was a big relief. But of course, as soon as our teachers were getting vaccinated was when we first had our first, I laugh now, but we had our first outbreak where there was on-campus transmission. It was really only 3 people in the end. It was really tiny. We've had other ones which were much worse, but that was as between the 2 doses, one teacher got sick. So it's literally like falling down right at the finish line. But so that was like the whole second semester was just getting everybody vaccinated. And we ended up having just a lot of, well, we still do. We have, we got virtually almost all the teachers vaccinated. There was like maybe less than 5 or staff people who didn't want to, because basically we had engendered a lot of trust over the course of the year saying, if you do these things, we can exist. And then people were happier because they had work to come to every day. Kids had school. There was regular, we're like we were when we're toddlers. We like a routine. And so everybody was in a much better place because of that. And then because they trusted in the process that, when the vaccine came and I was like, you've got to get the vaccine, everybody was like, yes, because there was all this trust that was built. And I think the same thing happened when, the 16-year-olds and up were added to the list, and all the family we had ended up having 80% of the kids get vaccinated. And there was some motivation because it turned out that 2 weeks after the second dose was when prom was scheduled. And so the whole and prom, our school is such a tiny school that prom is not like a typical, it's freshman through 12th grade. So it's everybody. So it's not really, it's like a dance. But so the kids were all motivated that were 16 and up to get vaccinated so they could go to prom and really let loose, even though it was outdoors and it was fine. But that was, so there were like little things like that. So, and I think that really helped. And even when, but then this school year was much harder. I mean, the political stuff, we're in a very, what people would say is a very red state. I think it's more accurate to say we're very libertarian. Like people just want to do what they want to do. That's been in the culture of this area for, generations. And so, I think that really made this year a lot harder. Like we ended the school year going, oh my God, this is amazing. We felt like we had done something really impactful. Like we had, literally saved a lot of lives. We had, the studies were showing that kids in school were less likely to contract COVID. Everybody had regular, the mental health was in a better place. I think the teachers, the same thing, coming to school, we were doing all this stuff. Everybody was on the same page. They even had a lower rate of COVID than, if you had just been living out in the world. So I really think we had made a big difference on multiple levels. But then, the politics got in and it got really complicated. And so then when school started again, it just, this year has been really hard. So this was much more divisive year and it's been much harder to navigate that. But basically what we did this school year was we had mask optional for everyone for whom the vaccine was available. So 12 years old and up. That was a little scary. We had COVID right away on campus, but it didn't really go anywhere. So it gave a lot of confidence that you could be pretty normal. Like what people were talking about other places being much more fearful. I was like, well, that's not actually the case. We are actually doing okay. But they wanted, there were people who were like, well, what about the little kids? Like, I want my freedom. I want to raise my kids myself. It was very political language. But we managed to hold off, not without a lot of ill feeling, to keep masks on the little kids and through the end of till December, because the vaccines started getting announced in early September that they were pretty sure it was going to be available by Halloween. And it really was. It was available like maybe 4 days after Halloween. And so we were able to hold people back off until everyone who wanted the vaccine could get it. And our population is about 50% of that group, which is a lot higher than the 15% nationally. So, and then I stopped helping because it was getting really, really contentious. And then Omicron happened and the school's been kind of blowing up. It's really like a super spreader and, it just hasn't followed the rules, but, it's navigating a different thing, the political piece, which I thought that wasn't really a role I wanted to do in as a purely volunteer basis.
Kind of looking back about how you were kind of touching upon trust and building that with both the parents and the staff, and as someone who is a physician by training, and understands kind of the science-based evidence for combating the pandemic, maybe if you could speak a little bit more about any ways that you or methods you use to try and communicate the science-based evidence to a system such as a school where education is kind of their primary focus.
For the administration, I put out, I would send an email to the headmaster, whoever the ops person is, like the vice principal or something. And then the 3 division heads, because this is a K through 12 school. So the lower school, the middle school, and the upper school. So I would send them, and the board chair, I would send them weekly emails on like new things, like the state of affairs, like what our COVID rates were like, and then kind of any new things that were happening. And then for me, I learned a lot of that stuff really through Twitter, because I had never really, I'm not a big, whatever, but my husband's he's in IT and healthcare. And he's like, you really should look at Twitter. And because there's a lot of really interesting things happening on there. And it was interesting because it was basically like redoing my residency, because all the people I would have loved to have had as my professors and stuff were on Twitter. And they were putting out like significant articles. So I didn't have to like try to figure out how to find those things. And they would talk about like, why is this significant or what was happening? And so then that's what I would do. Like, and I think a lot of other doctors were doing that, because you would see that on Twitter going, who's on Twitter tonight going over the latest things. And so that's how I found out like vaccines were coming, because you could see the messaging change. And before it got to the news stream, which would be 2 weeks later, I was like, oh, I'm pretty sure it's coming, because the messaging of Fauci or like Scott Gottlieb, who was on the board of Pfizer, changed abruptly from being like not certain to like saying, oh, definitely Halloween. And I'm like, this is completely different. And so what I would do is I would read all the literature that was coming out, and I would boil it down to something for the admin team, for lay people to understand, saying this is coming, or this is what's going to be what we should expect, or this is, I'm pretty 99% sure vaccines are coming for adults in December, or, stuff like that, or this is what we should be doing, and stuff. And then I would be on campus regularly and meet up with teachers. And then it would be even more boiled down to just the main facts, right? Make sure you mask, when we thought eye coverage was important, we would do that, I got them off of like worrying about cleaning stuff, because I was like, there's a ton of literature like at the beginning of the school year that was coming out saying this is not fomite transmission. So don't waste your time on that, just stop that now, or like trying to whittle things down and keep it simple. Or if there was significant stuff coming out, I would do either a big email to all of them, and then I would talk to them individually and say, this is what you need to do. This is what you need to watch out for. And so I think they felt like, and then they would read it for themselves later. It would turn up in the newspaper a week or two later. I'd be like, see, I told you it was coming. And so they would, they knew that I really stayed out of like education or any of that stuff. I didn't cross any of those boundaries. I just answered their medical questions and then kept it really straightforward. And that's kind of what I didn't put any opinions on anything. I just said, this is what's come out, let's see what happens. And stuff like that. And so I think that's kind of how I engendered a lot of trust. And then I think over time, like, when nobody was getting sick, or they were doing pretty well, or they're looking around at their other cohorts in public schools or other private schools who are online or this, that, and the other thing. And they were like going, oh yeah, you know what? I am glad I get to be here. I'm glad I have something regular to do. And I'm glad I'm not getting sick. And then I'm glad that you care. And it's not like there was much I could do except listen or just teach them what I knew. Like I was giving them free medical advice, basically, which I think they pretty much knew that was kind of a unique thing because, it's impossible to see a doctor. And so I think when they were getting that constant gift, and I think that built a lot of trust. And so then, when they, when they had questions about, should I get a booster or should I, then if I said, pretty much it got to a point where I was like, okay, it's time to jump. They would all jump. And I felt like, it's a little bit of am I doing the right thing or wrong thing? Or, but they, I had, they knew that their conversations with me were, even though I wasn't getting paid and I wasn't working per se, I maintained HIPAA standards. So they knew that, personal conversations or medical conversations with me were something that I would just have with them. And that I think that, it wasn't something I was going to run to their boss about and say, oh, this person's not going to get a vaccine or any of that. That was not anything that I did. And I think that was really helpful. And I also think it was also easier because the political stuff wasn't a big piece then yet. You know what I mean? There wasn't this whole vaccine denial stuff that came much later. So, especially for the adults, all the teachers got vaccinated in December, January, as soon as it came out of it's like would have been 2020, right? Yeah, and December 2020 and January 2021. And so that was before people started saying don't take the vaccine, and before that didn't start really happening till like March or a couple months later. So I kind of got them before I was there first, which was very helpful, I think.
Gosh, yeah, no, 100%. And, kind of building that trust from the start. That's interesting to kind of hear you speak about that, and then how down the line they would come to you about boosters per se. And yeah, that's awesome.
Yeah, I think that was a lot of work that, I don't even know, like when people criticize like what the larger institutions are doing, they're doing stuff that's so complicated, right? And I think guiding a lot of people who you don't know very well, right? Like, these are teachers that I kind of knew because they were teachers of my children, but I only knew them from that perspective as like a sort of a consumer, right? And so then I suddenly became sort of their coworker, which is a very different relationship, right? And so so I might have had a little bit of some grounding, because some level of who I was, but then I had to rebuild a whole lot of that. And I do think that I had less of a relationship with parents, right? So when you see, I had some, there was definitely people I talked down this year and stuff like that. But when it came time for the little kids to get vaccinated, I really had a lot less influence. I had a lot of people saying, well, I don't know if this is for me, and it wasn't, I didn't certainly ever push anybody. I was always just basically, especially with like staff who were reluctant, I just kind of said, any questions, just come to me. And, there were some people that I flipped, but it took a lot of conversations, and just really gentle. I wasn't really, it was just laying out information and letting them decide themselves.
And then also just kind of curious about any testing or contact tracing protocol. I know you mentioned that there was like kind of your first outbreak was only 3 students, and then
Yes.
there was a time when the teachers were transmitting between the 2 boosters.
Yes.
So I don't know if you were involved in kind of guiding about when to test or when
Right.
to contact.
So we had they had hired 2 new school nurses. So they had worked in the ICU, and so they were real nurses. One was a pediatric and one was a school nurse, but also had worked in telemetry. So she was an adult nurse. And so it was really great to have them, because they were invaluable, really smart women, super professional, super hardworking. And I think it was poorly timed, because one of the nurses had switched into being a school nurse from working in a pediatric ICU because she had 2 babies. And so being a school nurse is traditionally a much easier, more 9-to-5 regular job. And it was not that way. So we had contact tracing. Mostly what they did that first year was contact tracing and diagnosing, or sending kids off for PCRs. And being in Arizona, that was like, everybody does things well and poorly. And one of the things we did really well was testing. We had a lot of really great testing availability. The Arizona State University has been phenomenal, right? They had really amazing, easily accessible stuff. And so we used all those things to help us with testing. And then they did contact tracing. And contact tracing, you had to go back 2 days. So basically the nurses were getting positive cases or informed of positive cases like on weekends, holidays, weekends, Christmas break. We were working Christmas break, because vaccines were coming out, and some people were getting qualified earlier. Like if you were a PE teacher and a trainer, you were considered healthcare, so you could get it earlier. So we were trying to get those people in earlier. And so there really wasn't any break for them. And then they would get stuff at night. And so if you find out a kid is sick, at 7 p.m. at night, then you have to contact trace all the families that are close to that kid. So usually at the time, we didn't have any other treatment. So the contact tracing was large. So every positive case would pull up like 15 close contacts, 15 to 20 close contacts, right? Especially if it's in the middle school and they're changing classes and stuff. It was kind of a long list. And they had seating charts, and so they would call the division heads, who would call the teachers, find out the seating charts, figure out who's in the contact tracing, and then they would have to call all the parents. And of course, all the parents were freaking out and this, that, and the other thing. And so the nurses, I mean, they really were, I would say that people forget that school nurses probably worked as hard, if not harder, than people who were working in the ICU. I mean, it was different, but it was long, incessant hours, I mean, so, and that's ironic because it's supposed to be a 9 to 5, and really they were on call every night, weekends, for a year and a half. So that's what we did for contact tracing. We didn't really actually have on-campus testing until the Trump administration bought a bunch of rapid tests for schools to try to get schools opened. And so that didn't happen until a year ago, January. So then we started getting some tests. And so we would use those tests for on-campus diagnoses. And then because we had early access, we used those for test to stay in September, so that we didn't have to keep anybody off campus if they were a close contact this school year. We just tested them, and because we were seeing nobody was really flipping or was really uncommon. So then we used the test to stay for that. But yeah, so that was really lucky that we had tests on campus, so that, everyone who showed up to school with the sniffles or was feeling cranky, we could diagnose them, and they all had COVID. And so we just send them home right away. So yeah, so that's pretty much what we did. So it was pretty standard practice what we did last school year. And then this school year was people trying to claw it back and say, we don't want to do this anymore. And it was like, no, if you want to keep people in school, you have to, do this. But I think it's a big conflict in like, well, everybody else in the state is living like normal, which is true. So that became a much larger conflict this year.
Kind of looking at how you were involved pre-vaccine and then when the vaccine came out with this school, and just overall, definitely different waves of this pandemic, and kind of dealing with different attributes and building trust and kind of being the communicator. Any larger takeaways or lessons that you kind of think back to when you think about this experience?
Well, so being in medicine, well, I was in radiology, and it was for a reason, because I was like, well, I'm really good at homework, and people are hard. It's just really complicated. I was like, this is too much for me, which is how I ended up in radiology. And so it's funny that, I had to mature to this point, to the end of my career, where I finally figured out how to deal with that. And then I end up in this situation where I'm basically everybody's free doctor. And I think having seen people through this pandemic has like really been an eye-opening experience for like just realizing how complicated the human race and humans are. Like everybody has their things that they carry with them, and then dealing with a stressful situation like a pandemic or the unknown, just, you're just really stripped down to your bare bones. And I think that everybody has different things. I've learned a lot through that, and I've learned a lot about how people approach, even during this year, which it was harder, people approach conflict or disagreement. And that is just really, really challenging. And there's no right or wrong answer. It's just really hard. And I think that's why people remember stories that are so significant, right? Because not very many people hit on the right very often. Most people hit on the wrong, right? It's always turns out wrong somehow. Like you can think back at how things could be better. So I think that's been really interesting.
Thank you so much for your time today and for kind of sharing your story.